They usually run a routine test, and one of the tests is for diabetes. It's known as hemoglobin A1C, which checks for your glucose levels over a span of 3 to 4 months at a time. To understand diabetes, we must first know how our body works to use food as energy. For example, you eat a meal, it gets broken down into glucose, more importantly known as sugar to most people. Once this happens, there's glucose in your blood, and this glucose needs to be absorbed to be used in cells. There's a small organ in your belly known as pancreas, which releases a hormone called insulin. Insulin's job is to take that glucose from your blood and distribute it to all cells of the body so the cells can use it for energy. Now, if there's any problems with the pancreas making insulin or making enough but not having its effect, that's when you get diabetes. There are 3 different types of diabetes. There's type 1 diabetes, which is when the pancreas does not make any insulin. This is known as more autoimmune pathology. Type 2 diabetes is when the pancreas makes enough insulin, but the body has become resistant to the insulin, so it doesn't work as it should. There's third type, which is gestational diabetes, and this happens during pregnancy, and people who have never had diabetes before but now have diabetes when they're pregnant. Sometimes it takes a long time to even feel the symptoms of diabetes, but some of the classical signs and symptoms are polyphagia, which is excessive hunger, polyuria, excessive urination, and polydipsia, which is excessive thirst, and unintentional weight loss is another one. First of all, you want to follow up with your annual physicals with your primary care doctor. They usually run a routine test, and one of the tests is for diabetes. It's known as hemoglobin A1C, which checks for your glucose levels over a span of 3 to 4 months at a time. If the number is between 5.7% to 6.5%, we say you have pre-diabetes. What that means is your sugars are high, but they're not high enough to be in the diabetes category. And this is where a lot of our preventive medicine comes in to make sure you don't go into diabetes. Now, if your number is above 6.5%, you have the classical diagnosis of diabetes. And this is when your PCP may start medication and advise lifestyle changes. ABCs of diabetes are very important for patients to follow. A is for A1C. This is the hemoglobin A1C that you follow with your doctor routinely, and it lets you know how well you're doing with your diabetes. B is for blood pressure control, because equally important is to watch your blood pressure. And C is for cholesterol. We want your bad cholesterol to be less than 100.
If you like this video, please give it a thumbs up to help more people find this important health information. Click the subscribe button and the notification bell for access and reminders to more Emanate health videos. We upload informative video content every week.